Hi, this is Karen. Karen moved from Florida and recently got accepted into Long Beach State. Karen was always looking forward to becoming immersed in the community of college, so she began to look into it and she decided to rush for a sorority. One night, she was out with all her sorority friends, and one of them had a bright idea. She walked to a near park with all of her friends and found that they all began to smoke weed. She took part in it. She didn't want to feel left out. She had never experienced it before, but soon after that, it was day and night for her. She started spending a lot of time consumed in it. Her grades began to drop, and she even had a run-in with the law. Well, that last part happened in her dream anyway. Marijuana among college students remains a popular trend. THC, the activating chemical that produces the high, travels from the lungs into the bloodstream throughout the brain and into other organs. It produces a sense of euphoria as well as changes in mood, difficulty thinking, problem solving, and impaired memory. Also includes anxiety and paranoia, and it usually takes about 30 to 60 minutes to take into effect. Marijuana is carried throughout multiple organ systems and impairs body movements as well as contributes to slower motor gross functions and temporarily relieves pain.
Marijuana usage will also have a detrimental effect on the health as well. It can cause scarring and damage to the lung tissues and the blood vessels. It also increases the heart rate, which ultimately results in having a higher risk of stroke or heart disease in the future. And similar to tobacco, marijuana releases the same harmful substances that will have direct contact with the heart and lungs. And this can overall contribute to having heart and lung cancer. Smoking weed can also affect a person's attitude. The earlier an individual starts smoking, they can be at higher risk for developing an addiction. It also causes a lack of motivation and drive, which is most evident in academics and work ethics. People think it is a harmless way and a safer option due to the fact that weed comes from a plant. Some protective factors against marijuana usage may include strong and positive family bonds, parental monitoring of children's activities and peers, having clear rules of conduct that are consistently enforced within the family, involvement of parents with their children's lives, success in school performances and having strong bonds between the students and the teachers, and adoption of conventional norms against drug use.
There are many contributing risk factors to marijuana usage, and because of that, there are direct consequences. Risk factors includes individual, relationship, and community levels of influence. Karen, for example, was affected at the individual level because she felt the stress and social pressures from an outside community she was getting familiar with. At a relationship level, the risk factors for her using marijuana were contributed because of all of her peers taking part in this activity. At a community level, drugs and alcohol is a pretty common trend throughout Greek life environment and can be seen as it surrounded her and took influence. Marijuana is the most widely used illicit drug.
1 in 10 users will become addicted.
The abuse of marijuana usage can lead to financial burdens as well as run-ins with the law.
Marijuana usage is linked to addiction, effects to the heart, lungs, brain, and mental health. There is an increasing stigma of college students and their usage in this and other drugs. Many of the factors can contribute to stress, genetic disposition, depression, anxiety, environmental factors, as well as starting to abuse drugs at a younger age. As college students, it is important to be aware of the risks and protective factors, as well as the related consequences of getting involved in marijuana use.